We really never had an opportunity to tell all the rich stories that happen at Oakwood, all the physician stories, all the patient stories, anything that our caregivers have done.
You're listening to Champions of Care, brought to you by Oakwood Healthcare.
Champions of Care really fit that need and allowed us to tell a whole lot of stories on a weekly basis and then share those inside the organization.
I'm Lloyd Jackson. Join me Sunday morning at 10 for Champions of Care, brought to you by Oakwood Healthcare. I think it's a program where you just find so much information, and not only from the doctors and the nurses who appear on the program, but you also find out information about what's going on in your community, because the hospital is so well connected in the communities that they serve.
Champions of Care, I think, is a great program that we've started at Oakwood, because it not only helps inform not just women, but they know that this is happening every week.
Dr. Salil Kendwala is an OBGYN who specializes in urogynecology at Oakwood Healthcare.
In fact, one of my patients, she heard about it because she was asleep, but it was her husband who saw me on TV and said, "Hey, I think my wife has that problem. Let me talk to her." Champions of Care at Oakwood has clearly helped me grow my practice, at the same time inform our patients about management and women's health.
Oakwood's Champions of Care. We specialize in you, a good-for-you partner.
We augment that then with social media. We're all over Facebook, we're all over Twitter. We repurpose both the video and audio segments on our own websites, YouTube, other places. So again, we have an international reach with these programs, and I don't know that people always realize that inside the organization. We have our segment Everyday Heroes, in which a patient can suggest somebody, anybody. Sometimes we've had billing folks, we've had nursing staff, we've had imaging techs who come on the show and are thanked by a patient because they made a difference in their lives.
One is Mr. Frank Palazzolo, who is a person who was suffering from Guillain-Barré syndrome, a very debilitating disease, and he talked about how his back hurt and how he could barely get around, and he had a caregiver who came and helped him and really kind of nursed him back to the point where he could walk with a cane, which was amazing for him, and he decided to come back and help out with other patients and give them some hope.
Lori, thank you very much from the bottom of my heart. You are one of the best caregivers in that entire 6.5 months that I was hospitalized. She is my hero.
You're my hero too, Frank.
I think that's what the caregivers at Oakwood do every day. They enjoy what they do. They enjoy their work. They don't really look at it as work. They just look at it as being kind to another human being. That goes a long way.
What we've found in the 2 years of doing this show, it has established such a presence for us and has allowed us to have relationships with folks at WJR, WWJ, WDIV. All of the news providers in Southeast Michigan now look to us and call us because of the show. And also just spreading the awareness of who our physicians are and how good they are. And I think has built a lot of good faith between us and our physicians to show them you're important to us and we want to give you an opportunity to tell your stories.
I think your image is, here's a place that will care for me when I'm there in their facilities. Here's a place that will care for me when I'm not in their facility, when I'm at home, when I'm in my community, because they're in my community.
This really is Oakwood's show. Every employee, every physician, everybody who belongs to Oakwood, this is your show.